Deep vein thrombosis usually begins in the deep veins of the leg. Risk factors for this serious condition include hypercoagulable states, instrumentation, trauma, malignancy, and prolonged immobilization. Over time, the clot propagates. A portion of it may embolize and travel up the venous circulation into the inferior vena cava. From there, it enters the right atrium. The clot is propelled to the right ventricle and then up and out into the pulmonary artery. There, it becomes a pulmonary embolus within the pulmonary circulation of the patient's left lung. The clot obstructs flow to a portion of the patient's left lower lung. This area of the lung no longer receives its normal blood supply and is unable to exchange oxygen for carbon dioxide. The gray area of discoloration represents this non-functional region. A pulmonary arteriogram shows the absence of white branching vessels in the left lower lung. To compensate for the non-functioning left lower lung, the patient's initial response is to hyperventilate in order to bring more oxygen into the pulmonary tree. With a deeper and more rapid respiratory rate, more oxygen is drawn into the lungs, but more carbon dioxide is also exhaled in exchange. This may be reflected in an arterial blood gas sample. In a monitored setting, the patient with a pulmonary embolus may have a low-grade fever and an elevated respiratory rate. A tachycardia may develop as the heart compensates for the decrease in lung oxygenation. The pulse oximeter reading may be low. First-line therapy is supplemental oxygen to help offset the dysfunction of the affected region of lung. Breathing in oxygen-rich air may compensate for the deficit, improving the pulse oximeter reading. Other vital signs may improve as well, potentially obscuring the seriousness of the underlying condition. The next line of therapy is to administer an anticoagulant, such as heparin, which is given intravenously and followed by a constant infusion. The heparin acts to stabilize the clot and inhibit its propagation. Since the heparin circulates throughout the entire bloodstream, it has the same stabilizing effect on the clot within the lung. A patient with pulmonary embolism may become unstable with diaphoresis, tachycardia, and hypoxia. A more aggressive intervention for the unstable patient would be the administration of intravenous thrombolytics. The medication is distributed throughout the circulatory system and will lyse clots wherever they exist in the bloodstream. Thrombolytics are contraindicated in patients with active bleeding and those who have had recent trauma or stroke. The medication dissolves the clot within the deep veins and acts on the clot within the pulmonary circulation as well. As the clot resolves, blood flow and function can return to the affected region. In certain settings, the thrombolytic may stabilize the patient with pulmonary emboli and allow the vital signs to normalize.